5, we are going to see skin marking for first dorsal metacarpal artery flap. Let's briefly discuss about the anatomical aspect of the first dorsal metacarpal artery flap. And the artery supply to the flap was from the radial artery, which was before entering into the palmar arch. It gives a first dorsal metacarpal artery branch, which is again divided into ulnar branch, radial branch, and the intermediate branch. And based upon the ulnar branch, we have raising the flap, which also has the sensory supply from the first dorsal digital nerve from the superior branch of radial nerve. And the artery will course through the groove, which is formed by the second metacarpal bone and the first dorsal interosseous muscle. Hence, for the defect, which is over the pulp of the thumb, the bony landmarks like second metacarpal bone and the carpal bone and the first metacarpal bone and the carpal bone has been marked. And the first dorsal interosseous muscle has been marked. As you all know, the radial artery will course dorsally and it enters into the palmar arch through the two heads of the first dorsal interosseous muscle. And before that, it will give a first dorsal metacarpal artery branch, and it will have a ulnar branch, radial branch, and an intermediate branch. The ulnar branch supplies the dorsum of the index finger, and the intermediate branch for the first web space, and the radial branch for the thumb. The first CMC joint has been marked, and the MCP joint has been marked, and a kite shaped skin paddle has been marked as a islanded pattern flap, and a lazy incision where the dermal flap has been raised on either side. And the bridging portion between the donor site and the recipient site was planned for tunneling. And this is the template which we have created, and you can see the reach of the flap and the arc of rotation of the flap. And you can also see the operative video which we have uploaded.
Like, comment and press the bell icon and subscribe our channel for better number of operative videos in plastic and aesthetic surgery. Thanks for watching.